The World Health Organization warns that Africa is experiencing a resurgence in COVID-19 infections as countries relax their restrictions. According to the WHO Africa Regional Director Matshidiso Moeti, the number of new daily confirmed cases overall has started rising after slowing since mid-July, with substantial rise in deaths confirmed over the past week. But the Africa Center for Disease Controls John Nkengasong says the rise in numbers of reported deaths could also be due to an improvement in African countries' ability to document deaths from the coronavirus. Well, the rise in infection numbers grew in North, Central and East Africa, but cases declined elsewhere. Morocco, South Africa, Tunisia, Libya and Ethiopia are the countries driving the increase. The World Health Organization also points out that the rising numbers come as countries ease restrictions and reopen borders and schools. South Africa has the highest recorded number of total cases and reported deaths in Africa. Prior to the latest rise, daily reported numbers and hospital admissions had been falling for nearly 2 months. Morocco has overtaken Egypt and has the second highest number of cases, although Egypt is still the second in terms of deaths recorded so far. Egypt has the third highest number of cases, followed by Ethiopia and Nigeria. Dr. Mary Stephen, the Technical Officer for World Health Organization Regional Office for Africa in Brazzaville in Congo, joins us now via Skype from Brazzaville in Congo. Dr. Stevens, a very good evening to you. Thank you so much for joining us. Welcome to the Globe.
Good evening. Thank you.
We've been noticing the fears from different parts of the continent, especially in South Africa, about a possible resurgence or a possible second wave of coronavirus. What could have possibly driven those fears, given the fact that we are now well into the spring season, which ostensibly isn't so favorable for the coronavirus to thrive?
Thank you and good evening once again. Yes, with regards to the fear for increase in number of COVID cases, people are looking at what is happening in Europe and the United States. And as you can see, as they lifted the restrictions on international travels and some of those lockdown measures to reopen the economy, you can see the increase in number of cases, and every country is actually at risk, including all countries in Africa. So we need to make sure that we put in risk mitigation measures in place to avoid a second wave of the outbreak on the continent.
But then what then needs to be done to avoid a possible second wave, because some countries still have stringent measures put in place?
Okay, so now there are two things. First of all, countries have relaxed most of the lockdown measures. So for that, as the economy is reopening, the general population must comply with the preventive measures of wearing the face masks, keeping 1 meter distance away, regular hand washing, and avoiding mass gathering, as well as implementation of the public health measures, surveillance, testing, contact tracing, treatment, and isolation of confirmed cases must happen all at the same time in a very sustained manner. Secondly, countries that have reopened their borders for international travel, they have to make sure that as people move across, coming from countries with high rates of community transmission, that they are screening these travelers as they arrive, and a self-monitoring or any form of follow-up of these travelers while they arrive in the countries need to happen, so that early infection can be picked early enough and then isolated and mount an effective response.
And then the Africa Center for Disease Control says that the rise in numbers of reported deaths could also be due to an improvement in African countries' ability to document deaths from the coronavirus. Are you also of the same view? Do you share the same sentiment?
Well, there are so many things that could contribute to this. So basically, I think what we need is to make sure that we are reviewing these additional deaths we have seen in the past weeks and establishing where this death is coming from, whether it is happening in the community, in the facility. If so, why are we seeing increasing number of cases? Is it associated with the kind of people that are affected? So there are quite a number of things that could contribute to increasing number of deaths. But for me, I think we need to review further and understand better why we are seeing increasing number of deaths.
Well, certain countries, especially the Western and, the European countries, have often wondered why South Africa, or rather why Africa has documented such low rates in terms of coronavirus infections and as well as deaths. Could it be that the youthful population probably has to do with it? And could it be possibly an inherent immunity, possibly something to do with temperature and altitude? Am I correct in pointing it out?
Okay, so let's talk about what we know first, and because we know that this is a new outbreak, and of course there are still some things that we don't know. It continues to evolve, but for the continent in Africa, yes, some of the reasons why we are seeing lower mortalities compared to what you find elsewhere around the world is because, yes, we have younger population, because we know the things that contribute to mortality for COVID is higher age and the presence or high prevalence of comorbidity. So this has been established, and we know that for sure. So we have younger population in Africa, one. Secondly, the prevalence of those comorbidities on the continent is lower than what you find relative to what you find in other parts of the world, like the chronic cardiovascular diseases, chronic respiratory diseases, the issue of cancers, hypertension, diabetes. So we have much more of infectious diseases in Africa, but we know that the prevalence of non-communicable diseases is rising. But if you're comparing Africa to the Western world, definitely we have much lower NCDs than what you find elsewhere around the world.
Dr. Stevens, I want us to discuss in greater detail the issue of antibody testing. Well, I understand that in some countries it's underway. Can it be used as a barometer, perhaps, to check if large numbers of infections are being missed? And in the same vein, do you also think that underreporting of cases may also be, a factor, as it were, in the continent's low recorded transmissions?
Okay, so now let's talk about the issue of underreporting first, then we talk about the antibody testing. So for the underreporting, most countries really across the world, they are testing based on their testing strategy. So countries do test because of the capacities they have and the availability, of course, of the reagents and the peculiarities, the context in their country. So this is not limited to Africa, it's global, everywhere. So yes, it's possible if we are not doing community testing, there are some other cases out there, especially those that might be asymptomatic, if our testing strategy focuses on people that have symptoms and maybe people that have direct contact with confirmed cases. It's possible that some of those cases we may not pick them, but this is not, like I said, peculiar to Africa. It's happening globally. Then in terms of antibody testing, yes, if you do antibody testing, it shows you that if an individual is positive, it shows you that that person has been exposed to the COVID virus at one point or the other. So it shows evidence of previous infection. So it's possible, yes, if you do the antibody testing, like quite a number of countries are beginning to think about that in Africa, you might pick additional cases that, of course, you didn't pick while your testing mainly limited to people that have symptoms or contacts or confirmed cases. So yes, it's a good thing, and we encourage countries in Africa to do the zero prevalence survey.
And then there's what we call the pandemic fatigue. I mean, so much has been said about the coronavirus since the beginning of the year, and so much has been done to try curb this virus. And to get a sense then that people have grown tired of this, have grown tired of being restricted, and in terms of their lifestyle, in terms of their way of life, hence, turning their back on taking all the necessary precautions.
So this has been an unprecedented outbreak. There is no doubt. We have never had a situation where, especially for us in Africa, all countries on the continent are dealing with the same outbreak. It has been unprecedented. We haven't seen in recent time any outbreak that has had such a significant impact on the lives of people, the livelihood, the economy. And of course, this COVID came with a peculiarity in that a lot of government had to use these movement restrictions to limit the spread of the outbreak. And it has been a protracted outbreak. We started right from January across the world, and in Africa in February, from February 14 to date. It's been a long outbreak. So yes, there is a lot of fatigue, and as a result, people are beginning to get tired. In addition to that, because we are seeing decrease in number of cases on the continent, people are beginning to relax in terms of compliance with the preventive measures. But for us to prevent the resurgence of cases, we need to make sure that the general population continue to wear face masks, wash hands, keep 1 meter distance, avoid unnecessary mass gathering, as well as enhancing our capacities for response, testing, surveillance, case management, isolation, contact tracing. This is very important for us to mitigate the risks of a second resurgence on the continent.
From your analysis and observation of the patterns and the trends since the outbreak of coronavirus, hit the African continent, do you believe that the public health response of African countries prepared by the previous experiences such as outbreaks or epidemics, a case in point being Ebola in Central Africa, was more effective in limiting the transmission than in other parts of the world? And if so, why do you think South Africa did not apply that particular strategy, given that South Africa still records or has recorded the highest number of infections on the continent?
Okay, so now, yes, the action that the governments in Africa took, including South Africa, has helped to reduce or limit the spread, and as a result, we are not seeing the exponential increase in number of cases as we have seen in Europe and in United States. So yes, experience with previous outbreak is also, it was kind of an advantage for most of the countries on the continent, especially those that have dealt with this outbreak, Ebola, like you rightly mentioned, and the 9 countries around them that we were preparing for potential importation. So those were capacities that the countries leverage upon to ride with the COVID response. So these are some of the things that have contributed. And like we said earlier, the countries in Africa as well, they moved quickly with the closure of their borders, as well as implementation of lockdown, which has contributed to reducing the spread of the outbreak. For the South Africa case, the government, the effort is still commendable, even though South Africa is reporting the highest number of cases. I believe from the beginning, South Africa was disproportionately affected than other countries because of the high level of travel that is happening in South Africa compared to other countries on the continent. So all countries have really done a great job with limiting the spread of this COVID on the continent.
And just a quick one, Dr. Stevens. We're getting reports that the city of Jiangxing in south of Shanghai has started offering a coronavirus vaccine to the general public. Well, the WHO mentioned earlier that the coronavirus vaccine will be ready possibly before the end of the year. Should we rejoice at the prospects of getting a vaccine from China, perhaps?
So there are lots of candidate vaccines that have moved to phase 3 clinical trials, and definitely, yes, it's good news wherever we find vaccine that has gone through all the phases of trials and has received approval for COVID-19. It's good news not just for Africa but globally, and so we have to continue to depend on the science. As soon as we have any vaccine that is globally approved, then it will be available to everyone, including countries in Africa.
All right, Dr. Mary Stevens, great chatting to you. Thank you so much for your update. We appreciate your time.
Thank you.
All right, that was Dr. Mary Stevens, the Technical Officer of the World Health Organization Regional Office in Congo, Brazzaville, speaking to us live via Skype.